Welcome to the Deep Dive. We're here to get you properly informed. Today, we're tackling something huge, how digital tech is changing everything, even fields like healthcare. Specifically, we're diving into digital teaching and learning in nursing and healthcare courses, and we're zooming in on Germany.
Yeah, and our source today is really interesting. It's a detailed protocol for a scoping review. Comes from the University of Applied Sciences, Neubrandenburg. Think of it like a blueprint, how researchers are planning to study this changing scene.
Ah, so not the results yet, but the plan itself.
Exactly. And that's what's key here. This blueprint, this plan, it actually shows a big gap. We talk a lot about digital learning, but how much do we really know about what works, especially in somewhere like German healthcare?
Right. So that's our mission today then. Unpack why this research is needed, look at their methods, how they're planning to do it, and maybe get a sneak peek at what they've already noticed about digital learning over there in Germany. Let's get started. Okay, so first things first. Why this big digital push in Germany's healthcare education specifically? What's really behind it all?
Well, it's kind of two things pushing together. You've got the general trend, obviously, digital transformation everywhere. But Germany also has very specific laws driving it.
Laws, like what?
Things like a specific bit in the social code, Section 8 ABS, 8 SGB XI, which pretty much mandates certain digital stuff. Then there's the eHealth Act, broader stuff, and newer laws too, like the Act on the Nursing Professions. They call it the Pflegeberufegesetz, and the rules that go with it.
Wow, okay, so it's not just encouraged, it's legally required in some ways.
Yeah, pretty much. These laws are actively pushing for digitalization in how healthcare is practiced, which means, well, nurses and healthcare pros simply have to have these digital skills now.
Okay, so beyond just ticking legal boxes, how does this actually help? Do these digital skills lead to better patient care, better outcomes? Or is it more about efficiency?
It's definitely aiming for more than just efficiency. It's all connected. The whole idea behind digitalizing healthcare practice is to improve the quality of care.
How so?
By giving professionals these digital tools and skills, they're better equipped. They can handle more complex situations that come up in modern healthcare. So ultimately, yeah, the goal is better patient outcomes. It's about raising the bar for competence in a tech-heavy system.
You know, it's funny. We think of learning with machines as so modern, maybe even futuristic. But the source material suggests this idea has been around for ages.
Yeah.
How is that e-learning started with the internet?
Oh, not at all. It goes way, way back. You can actually trace it to the 1920s, a guy named Sidney Pressey.
The 1920s? Seriously?
Yeah. He built this machine. It asked multiple choice questions, gave 4 answers. Sound familiar? So the core idea isn't new. Today, e-learning just means any learning using electronic or digital stuff.
Okay, history lesson noted. But the researchers mentioned one specific international event that really, changed the game for e-learning more recently. What was that big moment?
Right. That would be 2007, the introduction of the iPhone.
Ah, the iPhone. Okay, that makes sense.
Yeah, it totally revolutionized mobile tech. Right.
And that created the perfect conditions for new ways of teaching. We started seeing things like flipped classrooms, blended learning really take off, because suddenly learning could be much more flexible.
Flexible how?
In terms of time, place, even the pace of learning, the scope too. And a huge bonus was, and still is, that most learners already have the device. They own a smartphone or tablet.
Right, removes a big barrier.
Exactly.
Okay, so bringing it back to this specific German study, this protocol we're looking at, what's its main goal? What are they trying to find out? What are the gaps they want to fill? Their main aim is basically to map things out. They want to map the evidence, identify the key concepts, the theories being used, the sources, and crucially, figure out where the knowledge gaps are, specifically for digital teaching and learning in German nursing and healthcare education.
So getting the lay of the land, essentially. Showing what we know and what we, don't.
Precisely. It's about clarity.
And to get that clarity, what are the big questions they're asking?
They've boiled it down to 2 main questions. First, what kind of educational content and teaching methods are using these digital formats in German nursing and healthcare? And second, what scientific evidence actually exists about how these digital formats are being used, again, specifically in Germany?
That focus on Germany seems really important here.
It absolutely is, because you can't always just take findings from, say, the US or UK and assume they apply perfectly in Germany. The systems are different.
Makes sense.
Yeah.
Now, this sounds like a massive undertaking. How are they actually tackling it? How do they make sure they cover everything properly?
Well, it is a big job, and they're being very systematic. They're doing what's called a scoping review.
Scoping review, what does that mean exactly?
It means they're looking broadly. They consider published primary studies, but also other reviews to get a wide overview, but they're not including things like opinion pieces or commentaries. They want empirical evidence.
Okay, evidence-based.
Right, and they're following strict guidelines for reporting it, all the PRISMA 2020 guidelines. That ensures transparency and rigor in how they present their work. Global standards.
Got it. So how do they decide which studies actually make the cut out of everything published?
They use specific criteria called PCC, population, concept, and context.
PCC. Okay, break that down for us.
Sure. So P, population, that's the learners, students in nursing, trainees in healthcare professions. C, concept, that's the digital stuff itself, the teaching and learning formats, the technology. And the second C, context, this is key. It has to be implemented in Germany and since 2007.
Ah, there's that 2007 date again, linking back to the iPhone.
Exactly. It marks that modern era of accessible mobile tech in learning.
Right. So where are they looking for all these studies? Which databases? And how do they avoid missing something vital?
They're searching across 6 major databases. Big ones like Medline via PubMed, Cochrane Library, Web of Science. Also ERIC, Prospero, and APA PsycInfo. A pretty wide net.
And searching in English only.
No, both German and English to catch everything relevant to the German context. And to make sure they're thorough and reduce bias, they have 2 researchers work independently.
How does that work?
They both search, they both screen the results, then they compare notes. If they disagree on whether to include a study, they discuss it. And there's a final consensus meeting to decide what makes it in. It's quite a careful process.
Okay, sounds very robust. So once they have their list of studies, how do they pull out the information and make sense of it all?
Good question. They move to what's called data charting. They've developed their own Excel form for this. And again, 2 authors code the data independently from each study.
Independently again? Wow.
To ensure reliability. They even calculate something called Cohen's kappa. It's a statistic that measures how much the 2 coders agree, beyond chance, helps confirm they're interpreting the data consistently, then another consensus meeting if needed.
Okay, meticulous. And then synthesizing, putting it all together.
For that, they'll use qualitative content analysis. They'll create categories, some based on their PCC framework, like the setting or the type of digital tool used, and others might emerge directly from the data itself, inductively. Then they'll summarize findings using basic stats, like relative frequencies and, how often different things appear.
Right, giving a clear picture of what's common.
Exactly.
Now, a really important reminder for you, the listener. This document we're dissecting is a protocol. It's the plan. Do we know when they expect to actually finish the search and analysis?
Yes, the timeline they set out was literature search scheduled for January 2025. And then the selection, the coding, assessing the studies that was planned to be wrapped up by March 2025.
Okay, so very current. As we're talking, these results might be just emerging or very, very close.
That's right. It's timely research.
So even before starting this huge review, did the researchers have any initial hunches? Did their preliminary digging show anything about what kinds of digital tech are already being used in German nursing education?
Yes, they did mention that. Preliminary searches did show various technologies are already out there. Things like specific learning programs, online learning platforms, even VR virtual reality is being used.
Interesting. VR in nursing training.
Yeah. The full review, of course, will give a much more detailed picture. It'll list everything systematically and try to assess the outcomes, the application areas, any specific requirements, and, the overall trends in Germany.
So they weren't going in with strong assumptions about why certain things are used. More exploratory.
It seems so. The protocol frames it more as discovery, which fits the idea of a scoping review mapping what's there first.
Okay. But this brings up a really critical point, doesn't it? We assume digital is better, but is the effectiveness of digital learning actually, like, a proven fact? Are there downsides, concerns from past research that this study needs to consider, especially for healthcare training?
This is probably one of the most crucial takeaways, even just from the protocol itself. It really highlights an uncomfortable truth. Despite all the buzz about digital transformation, the actual effectiveness of digital teaching and learning, it's not universally proven, especially in a specific high-stakes context like German healthcare.
So it's not a slam dunk.
Far from it. The protocol explicitly mentions other research, like a review by Bajpai and colleagues that found a lack of evidence for digital interventions being effective in health professional training.
A lack of evidence, wow.
Yeah. And others, Arkerful and Abadu, pointed out potential downsides. Like e-learning can sometimes lead to less interactivity compared to face-to-face.
I see that.
And other studies suggest outcomes aren't always straightforward. They can depend on things like the learner's age, how much training time they have, their prior experience.
That's lots of variables.
Exactly. And crucially, while these international studies give us clues, the researchers stress that you can't just assume those findings apply directly to the German education system. It's different.
Right. Which brings us back to why this specific German-focused review is so necessary.
Precisely. It's designed to fill that specific context-dependent knowledge gap.
Okay, so pulling all this together, this deep dive into just the plan for a study tells us quite a lot. Digital change is definitely happening in German nursing and healthcare education. Policy is pushing it, tech is enabling it. But the full picture, the actual impact, the best ways to do it, that's still being figured out.
Absolutely. And the fact that these researchers are being so rigorous, so context-specific, it just underlines how complex it is to adapt really critical fields like healthcare to the digital age. It's not just about throwing technology at problems.
Right.
It's about deeply understanding what works for whom, under what conditions, where the gaps still are, and how we apply all this knowledge effectively, ethically, especially when patient care is involved. High stakes.
Definitely high stakes.
Yeah.
Which leads to a final thought for you, our listener. Given everything we've discussed, the questions around effectiveness, the importance of context, the critical nature of healthcare, how might a study like this, which really zeroes in on the details, influence how you think about adopting new technologies? Whether it's in your own work, your field, or even just your personal learning journey, especially when you factor in those specific cultural or regulatory landscapes. Something to think about.